In this video, we will review our home health scheduling and staffing solution, Axxess CARE. Axxess CARE is a secure, HIPAA-compliant scheduling and staffing solution that is revolutionizing the delivery of healthcare in the home. Axxess CARE gives home health agencies control to connect with qualified clinicians to provide timely care. Axxess CARE is seamlessly integrated into our Axxess Home Health solution. Home health agencies will post visits to Axxess CARE. Then qualified clinicians near the visit's location apply for the visits on the Axxess CARE app. The home health agency will then review the applicants and assign the visits to the preferred clinicians. The preferred clinicians will accept the visits within the Axxess CARE app as a confirmation. Lastly, the clinicians deliver quality care to the patient, timely submit the visit documentation, and get paid. Axxess CARE is currently available to home health agencies and clinicians in the following states: California, Nevada, Arizona, Texas, Oklahoma, Illinois, Wisconsin, Michigan, Indiana, Ohio, Pennsylvania, Massachusetts, Virginia, North Carolina, South Carolina, and Florida. If you are in one of these states and are an Axxess Home Health client, Axxess CARE is already included in your subscription at no additional cost. To get started with Axxess CARE, simply let your implementation specialist know you are interested in Get Started. Once activated, the next time an administrator logs on to the Axxess.com, a pop-up will appear. Click Get Started on the pop-up window and follow a few simple steps. By clicking on Get Started on the pop-up, you're agreeing to Axxess's terms of service. After the above action, please refresh your browser and you will see the Axxess CARE tab on your Axxess Home Health dashboard between Schedule and Billing. You can post visits through Axxess Home Health directly from the patient's chart, the Schedule Center, or the Axxess CARE tab. Let's start from the patient's chart. Open the chart of a patient for whom you would like to post a visit to Axxess CARE. If you already have visits scheduled, identify the upcoming visit you would like to post and select Post to Axxess CARE, as found in the Action column. A new window opens showing you the visit details. First, decide whether you want to post internally to your staff only or externally to the pool of qualified clinicians closest to the visit. As an internal scheduling solution, you can broadcast visits needing coverage to your staff. When you post visits to Axxess CARE internally, all clinicians within your agency who have the Axxess CARE app will be notified that the visits have been posted, and those available can apply for the visit immediately within the Axxess CARE app. The internal visit feature is beneficial to your agency because it saves you time when coordinating clinician schedules and provides easy coverage for weekend and additional shifts. As a staffing solution, the external posting feature, your agency can connect with qualified nurses and therapists who do not work for your agency. This helps you connect with additional qualified clinicians in your area. The external feature of Axxess CARE serves as an easy tool to help you grow your business in new geographic areas or in new service lines. For now, let's leave the box unchecked to post this visit as an external visit. Next, choose the task type for the visit selected. For example, assessment and training, or diabetic management, or administering medications. Axxess CARE matches the visit task with the clinician's competencies that they fill out when they sign up for Axxess CARE, connecting you with the right clinician. I will select my task and then click Confirm Posting. You can also post visits from the Schedule Center. From the patient's chart, select Schedule Activity to open the Schedule Center. Just like on the patient's chart, you can quickly post to Axxess CARE under the Actions column, clicking on the teal hyperlink Post to Axxess CARE. To post multiple visits to Axxess CARE at once, select the Post to Axxess CARE button at the top of the Schedule Center. This will open a new window where you can select the visit type, the detailed visit task depending on the patient's needs, and the visit dates based on the frequency. Then click on Post to Axxess CARE. Now you can choose whether to post the visit internally or externally. Leave this box unchecked to post visits externally and click Confirm Posting. To make it easy for agencies to identify these visits in Axxess Home Health, we have a teal heart for external visits and a purple heart for internal visits. Hover over the hearts to see a small banner that explains the type of visits represented on Axxess CARE. On the Assigned To column, you will see a count of applicants who have applied for the visit. This visit currently shows 0 applicants, but as soon as you have applicants, it will show the count. The Axxess CARE scheduler makes finding coverage for your patients easy when the primary clinicians are temporarily unavailable. To post visits to Axxess CARE via the Axxess CARE scheduler, click on the Axxess CARE tab on the main menu and select the Axxess CARE scheduler. If a clinician is out for a week or 2 weeks and you want to post all of their visits to Axxess CARE, this is a quick and easy way to do this. Start by setting the date range and then search for a clinician's or patient's name. All of the associated visits will populate. Select all or multi-select which visits you would like to schedule. Remember, you still have the option to post them internally if you want your staff clinicians to pick up these visits, or you can post them externally for a wider pool of qualified clinicians. Now select Confirm Posting. Now that we have posted visits to Axxess CARE and seen how to schedule visits from several areas within the software, let's switch over to Axxess CARE platform to manage the visits. To switch to Axxess CARE, go to your Axxess CARE menu tab, then select Switch to Axxess CARE. You can also switch to Axxess CARE from the Axxess Planner or under Logout by selecting the Axxess CARE product. The first time you log into the Axxess CARE platform, you will be prompted to set up your account. This information can always be adjusted as needed. Setting up your Axxess CARE account is quick and easy. First, set your default standards for visit pay rates. These rates will be used when posting visits to Axxess CARE. Note that you will always have the option to customize each individual rate after posting your visit. To better assist your agency attract qualified clinicians, fill visits quickly, and deliver timely care, Axxess CARE has provided suggested pay rates for each visit type based on payment trends in your local area. Note, however, that there are minimum visit pay rates to help your agency quickly meet staffing and scheduling needs. Next, designate a primary contact person. This should be the most readily available point of contact for your clinicians whenever they have questions about visits. After you're done with your account setup, you can now explore your Axxess CARE dashboard. On your home page, the Axxess CARE platform is divided into 3 sections: Visit Alerts, Posted Visits, and Messages. Under the alerts, the first thing you will notice is your alerts. These are the visit alerts that your agency will track to make sure that everything is in order. You can see what visits are not started, pending acceptance, past due, scheduled for today, and currently in pending QA. Right below your alerts, you can see all the visits that you have just posted. At a glance, you can view the patient's name, the visit date, the type of visits, who posted the visit, and the date the visit was posted. If there are any messages or applicants associated with each visit, these boxes will turn green and include a count. To the right of these is a list of messages from different clinicians who have reached out to the agency. The agency can quickly reply to the message from here. Under Visit Assignment, to review and assign clinicians, select one of the visits by clicking on the blue View Visit button. Add more descriptions about the visit by clicking on the pen and paper icon next to details. This helps clinicians applying have a clear picture of what the visit entails, such as if it was a wound vac or a dressing change, or if all the supplies are in the home. Edit the address to the patient's home by clicking on the pen and paper icon. Verify any visit information or address by typing it here and leveraging our Google Maps integration. You can also update the visit address here if the patient is in a different location temporarily. Adjust the visit pay rates by clicking on the pen and paper icon here. Any changes you make from within the visit will be applied to all visits for this patient posted on the Axxess CARE platform. Include any special instructions for the visit. This is HIPAA-compliant information for the visit, and that is only viewable to the clinician who is assigned to the visit. For instance, maybe a gate code. To remove a visit, click on the blue Remove Visit button. This will delete the visit from Axxess CARE platform. Below the Remove button is a message section. You can see a message thread regarding any of the visits. Any inquiries about those visits will be displayed here, and you can quickly reply to them from here as well. Under the Visit Activity Log, an activity log is available on every visit posted in Axxess CARE to enable your agency to track all actions that have been taken on a visit. By consolidating all visit activity in a central location, the activity log enables your agency to seamlessly track and monitor visit activity and enhance clinician accountability for assigned visits. Now let's review the applicant section. Let's review a clinician. At a glance, we can see the clinician's credentials, any self-screenings completed, experience, and star rating of any applicants. In addition, we highlight any clinician who has worked for your agency or worked with the patient. To further review an applicant, click on the applicant's picture or name. On the left side, we can quickly see their discipline, experience, completed skills competency, availability, phone number, star rating, bio, and a resume if attached. Under tax documents, you can view any tax documents from the clinician. If the clinician has provided a tax document, your agency can download it from the Downloaded button here. Consequently, your agency can upload any tax document for the clinician from the Upload button. As part of the clinician sign-up process, we collect all the information that helps clinicians showcase their skills and help agencies provide quality care through the right clinician. This essentially is an electronic HR packet. Axxess will run background checks and OIG checks. Review the clinician's background check and an OIG check and download to store a copy. Verified license have a green check mark against them with the verification dates. Review any resume and additional certifications submitted by the clinician, such as the clinician CPR, OASIS, or wound certifications. Right below this, there are health screening documents. View and download the clinician's health screening documents, like a TB fact sheet, hepatitis B vaccination, or any other additional documents. If a clinician has worked for your agency, you can view any recent visits they have completed for your agency and the status of these visits. You can also see all recent reviews they received from different agencies for whom they have completed visits. Assigning visits. To assign the visit, click on Go Back to go to the Visit Details page. From here, select a clinician and click Assign Visit. In the same way you can post multiple visits to Axxess CARE, you can assign multiple visits to a single clinician. To complete this process, you will need a credit card on file or have the option to add a new payment method. Your credit card is only charged a single amount of the visit when you assign the visit to a clinician. Once you do so, the funds are held in escrow by a third-party payment processing company. The clinician only gets paid when they complete the visit note. Your agency reviews and approves the note in QA Center. Our clinician will receive a push notification alerting them that they have been offered a visit. Once they log into Axxess CARE app, they will see a purple banner with a time limit to accept the visit. In this case, since the visit is for today, they have 59 minutes left to accept the visit offer. If they don't accept the visit offer, it will expire and the visit will return to the agency and revert to posted status. On the Axxess CARE app, we will accept the visit. The visit status will update to assigned. Now that the visit is in assigned status, the clinician can select the visit and document on the visit straight from the Axxess CARE app. Here they can complete all documentation and complete electronic visit verification, including receiving the patient's signature. After the clinician is done with the visit, They will complete the visit and submit it back to your agency to perform quality assurance. To track the progress of your visits, return to the dashboard of the Axxess CARE platform and review the alerts section. Once the Axxess CARE clinician completes the documentation, it is submitted to your agency's Quality Assurance Center. To quickly filter Axxess CARE visits, use the teal Axxess CARE button. Open the task to review the note and either return or approve your note per your agency standards. If returned, the clinician will get a push notification asking them to provide further edits. From a payment perspective on Axxess CARE, the clinician has not been paid and the funds are held in escrow. The funds are released to the clinician once the visit note is approved and rating has been given. Once you approve, a new rating window opens. If you rate a clinician's visit 3 stars or less, you must add a reason explaining why. 4 and 5-star ratings do not require comments but are encouraged. Once approved, the funds will be released to the clinician. Reporting. A built-in report is available within Axxess Home Health to help you track the progress and status of your visits posted on Axxess CARE. To view a built-in report, open the Posted Visit Summary tab under the Axxess CARE menu. This gives you a snapshot of all the visits that have been posted on Axxess CARE. You can see the status of the visits and who they are assigned to. Quickly filter by patient, task type, a specific date range, or discipline. For your convenience, you can sort through the visits by clicking on the column header. A little triangle will appear to indicate how this page is being sorted. This concludes the video on Axxess CARE. If you have any additional questions, please reach out to us via our online support ticketing center.